Hello, Dr. Hilliard here. I'd like to welcome you to the safety portion of our hyperbaric training program. We're going to discuss today some safety precautions. First of all, hyperbaric oxygen therapy chambers are safe. The chambers use filtered ambient air, so there is no risk of oxygen toxicity to the body, even with regular use. The chambers can be pressurized and opened from inside. Once inside the chamber, both visual and verbal communication is possible with the outside. Most people report a comfortable, relaxing experience and emerge from the chamber feeling refreshed. This treatment is non-invasive and non-toxic. There are no dangerous side effects reported. Hyperbaric operators should ask if patients has any cold or flu symptoms, fever, sinus or nasal congestion, or chest congestion. The patient must be asked if there is a possibility that she may be pregnant. The patient must be asked if there has been any changes in any of his or her medications, if one has skipped a meal prior to his or her hyperbaric treatment, if the patient is diabetic and did not take his or her insulin prior to treatment, or if he or she has any concerns or anxiety. The basic counter indications are sinus infection, colds, flus, pregnancy, cardiac disease, COPD with air trapping, upper respiratory infections, high fever, emphysema with CO2 restrictions. Basic rules for mild hyperbaric chamber use include no drinks, no shoes, no pens, no pencils, no keys, no lighters or matches, and no perfume. When the patient is transitioning in and out of the chamber, the technician should always protect the zipper and educate the patient on the possibility of ear pain and the basic rules of mild hyperbaric chamber operations. Once the patient is in the chamber, it must be pressurized. Standard compression techniques bring the patient to maximum pressure during standard inflation of the chamber. Slow compression techniques. A safe and effective compression technique used to reduce middle ear octic barotrauma. Bringing the patient to 1 psi for 2 to 3 minutes, then 2 psi for another 2 to 3 minutes, 3.5 psi, and so on and so forth, all the way up to 4 psi. If the patient complains of ear pain, the technician should decrease the pressure until there is a reduction in the amount of pain. This technique is especially effective with infants and children. Stair-step procedure is a safe procedure and effective compression technique used for children and adults with acclimation or ear problems. The technician should instruct the patient to give visual or verbal commands to notify the operator if the pressure is increasingly too fast for the ears to acclimate. The technician then will raise or lower the pressure while increasing the pressure each time. Standard deflation brings the patient back to normal atmospheric pressure by turning the valve opening. Rapid deflation for immediate extraction of a patient. This should be used in case of sickness, bathroom needs, vomiting, paranoia, or personal emergency. This process should take no longer than 20 seconds. The technician should instruct the patient to stick his or her fingers in the release valves, open the turning valve, and remove both hoses from the connectors. And then when the pressure falls below 1 atmosphere, the technician should instruct the patient to open the zipper. Finally, one potential issue for HBOT chambers is chamber burst. This is extremely uncommon. Chamber burst can be caused by the chamber taking on too much pressure, zipper malfunction, or weak weld. Chamber burst is harmless to the patient, but can be an unpleasant experience because of the surprising loud noise associated with it. Mild hyperbaric oxygen therapy is an amazing therapy. When used with these procedures, your hyperbaric experience is going to be safe and effective, not just for you, but your patients as well. I'd like to thank you for joining me in this hyperbaric training program, and I wish you the best.